Hi, I'm David Starbuck-Smith, and today is all about what you can do if you've had a lumbar fusion. Many people after undergoing a surgery like that don't know that there's anything they can do for their back because after all, it's been fused. But I'm here to tell you that that is absolutely not the case. There's so much you can do and there's so much you should do if you have a lumbar fusion to keep your spine, your shoulders, and your hips functional. So even though you don't move in some parts of your back, other parts of your back are moving and sometimes they move too much, which means there's a risk for the vertebra above and below the fusion to compensate for the vertebrae that aren't moving. So you want to make sure you stay strong, balanced, stable, and you restore motion to your shoulder joints, your shoulder blades, your hip joints, and your pelvis. As long as you have mobility everywhere else, you can get by with no pain and no problem. If you stop moving your back, if you stop moving your body because of this fusion, because you don't want to hurt yourself or you remember the old back pain, or whatever the reason, if you stop moving, that's when you're going to start losing your function and your ability to maintain your overall quality of life. And some of these other joints like the shoulders, the hips, the back, other parts of your back might start to hurt, they might start to ache, and that's what you don't want. So these exercises are all about restoring motion, function, balance, and stability to all the parts that are necessary and important to maintain your quality of life or even improve your quality of life if you've had a fusion. So here we go, stay with me right now. Okay, the first exercise you're gonna do, you're gonna pigeon toe your feet. So you wanna touch your toes together, kick your heels apart. And first, you're gonna spread your fingers out. Curl the top knuckles in the ball of your hand. Middle knuckle right on your temple, thumbs down. And you're gonna now pivot your knuckles on your temples until your elbows come together. And then you're gonna bring your elbows all the way back as far as they go. Now the best way to do this is to do this against a wall. So your heels, butt, head, and shoulders are all up against a wall. But I'm gonna do it right here for you because if you don't have a wall, you can do it in the middle of the floor. And you're just pivoting back and forth. Your knuckles are literally pivoting on your forehead. You're bringing your elbows together, bringing your elbows back. Now this exercise is all about maintaining and restoring motion to your shoulder joints and also to your upper back. Your upper back has to stay mobile. It has to stay functional for the rest of your spine to be happy, especially and including the part that's been fused. So many people think there's nothing I can do. I've had a fusion. I'm destined to be in pain or stiff. It's absolutely not true. You can do these exercises. You can maintain function and motion to your whole body and be just as happy. So keep your feet pigeon-toed now. You're going to do about 25 of those, about 25 or 30 of these elbow curls. Next one, left hand in your left shoulder, right hand underneath your left elbow. Pull it straight up overhead. And you're going to relax your stomach, push your knees back, get the weight on the insides of your feet. Now the reason you're pigeon-toed is because when you pigeon-toe your feet, you rotate your knees and your legs and your upper leg bones internally. As that happens, it kicks in your lateral hip and it loads your major load joints, meaning it stacks up your ankles, knee, hip, shoulder, and ear in a straight line. So pigeon-toeing your feet helps to stack you in the right place, which helps to balance your spine. It also makes sure that there's no imbalance. So if your feet are just side by side or one foot in front of the other or one foot turned out more than the other, that's no good. You're training an imbalance. This position trains symmetry and balance. You're gonna hold this, you're gonna pull it straight up, both elbows up overhead, relax your stomach, hold this for about 30 seconds to a minute if you can. And then you're gonna switch. Right hand on the right shoulder, left hand underneath the right elbow, pull it straight up overhead. And breathe. Now you might find the one shoulder is tighter than the other. That's imbalance right to left. That's normal, but not okay. We want to make sure that the shoulders are balanced and functional. That creates a balanced and functional upper spine. And if you have a lumbar fusion or if you have any kind of fusion in your body, then as I said, you've got to keep balance right to left, top to bottom, front to back as best you can. You can work within the limitation of a fusion. You just have to make sure everything else stays functional. Okay, and relax. Now, keep your feet pigeon-toed. Grab your hands behind you if you can. If you can't, hands at your sides. But if you can grab behind you, you're gonna keep your feet pigeon-toed. Take your shoulder blades, squeeze them back, pull your shoulders down, pull your hands off as you squeeze and release. Squeeze, release. So you're squeezing your shoulder blades, pulling your hands off your back as you do it. And what we're doing here is we're simply asking the upper spine, the shoulder blades, to function, to move, to maintain balance and symmetry. So this is an important exercise to mobilize the part of your back that can stay mobile and needs to. Squeeze, release. And as I said, if you can't grab your hands behind you, don't worry about it. Keep your hands at your sides. Squeeze straight back and then release. So you're just doing regular scapular movement, regular scapular contraction, keeping everything as functional as you can. Okay, the next exercise is you're going to lie down on the ground. For this exercise, you're going to be lying on the ground. You're going to get the soles of your feet together and let your knees drop out as far as they go. You're going to relax your head and you're just going to breathe. Inhale, let your stomach rise. Exhale, let it fall. Now this exercise is doing a lot of things. You're going to feel a stretch on the inside of your thighs. But what it's doing is as your knees drop out, you'll notice that your lower back comes up off the floor, as it should. Don't press it down, let it come up. That's because your pelvis has rolled forward over your leg bones. And what that does is that creates a little arch in your lower back. So this is a passive motion for your lower back. It's passive extension for your lumbar spine, fusion or not. And the reason we like it is because it's letting the pelvis move independently of your spine. It doesn't require your spine to do anything except just sit there while your pelvis maintains its function. So we're getting a pull in the inner thighs. We're getting the pelvis to roll into a little arch, meaning the pelvis is rolling forward and putting a little arch in the lower back passively. And we're achieving also some symmetry and balance as you breathe. So inhale, let your stomach rise. Exhale, let it fall, and just let your knees drop. Inhale up. Exhale down, and let it fall. Inhale up. Exhale down. You're going to hang out here for about 2 minutes, just breathing, letting yourself relax, deep breathing, engaging the diaphragm and involving the diaphragm as you breathe. That's why as you inhale, the stomach rises. Exhale, and it falls. And just relax your shoulders, relax your upper body. And this is a very great, easy, relaxing exercise you can do anytime. Okay, the next exercise. You're going to lie down on your back just as you were, only this time you're going to put your legs up the wall. So you want to scoot as close as is comfortable to a wall or a door. This is a door for me. And if you can get your hips all the way up, great. If you can't, don't worry about it. But your legs are going to go straight up. You're going to relax your head, relax your shoulders, palms up out to your sides. Push your knees towards that door or wall and flex your feet back. Now it's important your feet stay pointing straight ahead. Don't let them turn out like this, and don't let them angle out. So don't let them turn from the outside in. You want to make sure that you can almost imagine you are setting a dinner plate on top of your feet. So they should be as flat as you can. Feet flex back towards your knees, thighs tight. Push your knees towards that wall. If it's too painful in your hamstrings, you scoot back away from the wall until it isn't. But you want these knees straight as you can get them. And same thing, relax your shoulders and just breathe. But push those knees towards the wall, flex the feet back, and you're gonna hang out here for about 3 minutes. Now this exercise is fantastic for a lot of things. One, of course, you'll feel a hamstring stretch, but what you really are doing here is when the legs are straight up on the wall like this and your feet are pulled back, is you're asking the floor to be a reference of straight for your spine. So we're actually rebalancing your spine right to left and top to bottom here as you lay here and as you breathe. So this exercise alone is fantastic if you've had a lumbar fusion, as long as there's no sciatic nerve pain. If you have any sciatic nerve pain, then you want to make sure you skip this exercise or do it with your knees just bent while you're hanging out so that there's no pain. But if there's no sciatic nerve pain, no pain going down or numbness or tingling going down your legs, then hang out here for about 2 to 3 minutes. And you'll notice your hips, your back, everything starts to sink, starts to relax, and starts to feel pretty good. And then after a couple minutes, You're going to interlace your hands together, palms together, and pull your hands straight up overhead, keeping your elbows as straight as you can, and trying to touch your hands over your head towards the ground as far as you can go. If you can only go to here, that's okay. You can only go to here, no problem. You just want to go as far as you can comfortably go without bending your elbows and without arching your back to get there. So whatever you can do, do what you can. This exercise, again, is restoring function and motion to your shoulder blades and to your upper back. It'll also put a pretty good stretch all the way down the muscles into your hips, so your lat muscles, your QLO, and all the muscles that attach into your hips, so to help balance those out too. And you're just going to do about 20 of these. It should get easier as you go as well. And it will feel pretty good. And as you get more comfortable with the back of your legs, with your hamstrings, if they are feeling loose and you want to scoot closer to the wall, go for it. If you want to scoot further away from the wall, do that too. Just back and forth until you get to about 20. Okay, and then you're going to come up. Now, for this last exercise, you're going to keep that same door or wall space. You're going to lean against it, walk your feet forward. You're going to do essentially a wall sit. Your feet should be about fist width apart. You're going to slide down the door or the wall just shy of 90 degrees. So you don't want to go too low. You should be able to see your toes. If you can't see your toes, walk your feet forward a little more. Press your lower back, the small of your back. Press it into the wall or into the door so that there's no space between your lower back and the wall. Weight towards your heels, and you're just going to hang out here. Now, this exercise is doing a multitude of things, but one of the things it's doing, as you press your lower back into the wall, you're helping to take the twist or any rotation out of your lower back. And that's important because any kind of twist that's still in your back, even after a fusion, and it's very, very common, is going to lead to other aches and pains up your spine, on one shoulder blade or one trap, one side of your neck, even spasms on one side of your mid-back. You don't want that. You don't want any of that. But this exercise is going to help that. Also, it's going to help balance out your weight distribution right to left. And of course, it's going to help strengthen your thighs. But that's not why we're doing it, but it's an added bonus. So keep pressing your lower back flat into the wall. Weight towards your heels. Don't forget to smile. And you want to hang out for 1 minute to 2 minutes. That's all you need. The record is about, I think the record is about 11 hours, 11 or 12 hours. So I don't recommend that. Don't try and break the record. Just 1 to 2 minutes is more than enough. Okay, so that's it. You want to do these exercises at least once a day. If anything causes pain or increases pain, skip it and move to the next exercise. And always make sure that you have your doctor's permission to do any kind of exercise, especially after a fusion. If you like this video, please click like and please subscribe to my channel and tell other people about it as well. Thanks for joining me today. See you again soon.